Morning to everyone. I am Dr. Ajay. Today we will discuss about one very important topic, the stages of ASOM. I am not going to give in detailed explanation about ASOM. The stages of ASOM. It is very important both for your pre-final purpose, the viva voce question, and for your exam point of view. Okay, the competitive exam. They will ask which stage contributes to which science or how it will appear. Okay, so we will go regarding ASOM. So what is ASOM? ASOM stands for acute suppurative otitis media. This we all everyone know. Acute suppurative otitis media. What it mean? Acute suppurative otitis media means it is a acute inflammation of middle ear. Acute inflammation of middle ear. Okay, and this constitutes of, there are 5 stages in ASOM, which is very important. There are 5 stages in ASOM. Okay, the first stage is called as stage of tubal occlusion. The first stage is stage of tubal occlusion. Okay, the second stage is stage of pre-suppuration. The third stage is stage of suppuration. The fourth stage is stage of resolution. The fifth is stage of complication. Okay, so these are the 5 stages: stage of tubal occlusion, stage of pre-suppuration, stage of suppuration, stage of resolution, and the stage of complication. These 5 stages, the examiner, when they ask in viva voce, they will surely ask, when you are presenting a case of CSOM, they will ask about what are the stages of ASOM. Okay, this you must not make a mistake for a pre-final, and for a competitive exam I will explain what will be asked in exam. So now we will discuss what all the symptoms, what all the signs which happens in each of these stages. Okay, each stage it's like the sequel. Okay, the first stage, as I said, is a stage of tubal occlusion. So as the name indicates, it is the tubal occlusion. Repeated MCQs for your competitive exam, they will ask the first stage of what will be the problem if there is a ASOM. There will be a tubal block. Okay, and in a viva voce or in a practical exam, they will ask what happens in a CSOM case. The first stage which happens is a tubal occlusion. Without knowing this tubal occlusion, we can't go for the exam, right? The first stage is the stage of tubal occlusion. So what happens? Pathologically, say if this is the Eustachian tube, as we already explained, this is the Eustachian tube, this will be the middle ear, right? So, and where is the Eustachian tube? The Eustachian tube is around this area, right? That is, it runs in the, where it runs? The nasopharynx. It starts from the nasopharynx. Okay, in the nasopharynx there will be cartilaginous part. Okay, and the bony part will be in, this we already discussed, the bony part will be in anterior wall of middle ear. Okay, so what it does, what is the function of Eustachian tube? The function of Eustachian tube is to clear the middle ear secretions back into the nasopharynx. These middle ear secretions, it will go into the nasopharynx and the patient will swallow it. Okay, or else the next important function is to maintain the middle ear pressure. Okay, so this Eustachian tube is an important one for maintaining the middle ear pressure. So two things: one is maintaining the middle ear pressure, second thing is clearance of secretions. So what happens in the first stage? In the first stage, there occurs edema because of some nasal obstruction, because of some URI. What happens? There will be edema and there will be collection of fluid, that is hyperemia, over the cartilaginous part of nasopharynx. Okay, so first thing, there will be edema over the cartilaginous part of the nasopharynx over the Eustachian tube area. Okay, so what happens here? Say when there is, so in this area, now there will be edema. Okay, once there is a edema, what happens if there is a edema? There will be blockage of eustachian tube, right. So once the eustachian tube is blocked, what will happen now? The eustachian tube which maintains the middle ear pressure is blocked. Okay, so what happens? There will be negative pressure generating in the middle ear. So the middle ear will now have a what pressure? Middle ear will be having a, there will be negative pressure in the middle ear, right. So this we all know, there will be negative pressure in the middle ear. So what happens if there is a negative pressure in the middle ear? So what happens now? The first stage, what happens here? The symptoms. So now if the patient present with this complaint, okay, with this in this stage to a ENT doctor like you, so what will be the presenting complaint? He will just come with the complaint of ear blockage, okay, ear blocking sensation. That means a deafness. He will come with a something is blocking, I am unable to hear, and there will be, he will also sometimes say that he is having mild ear pain, not a severe one, there will be a mild ear pain. Okay, so now what you want to do, or when you examine you need to find out which stage is this. So what will be the sign now? I am not going in treatment and all, I am just explaining the stages of ASM. The treatment we will explain in another PPT or another class. Now what will be the sign now? What happens here? Say now there is a negative pressure in the middle ear. Okay, so when there is a negative pressure in the middle ear, okay, when there is a negative pressure in the middle ear, say if this is the tympanic membrane and this is the middle ear, okay, say now it has a negative pressure. So once there is a negative pressure, what happens? The tympanic membrane will be turning, because it's like something is sucking in. So because of the negative pressure, the tympanic membrane gets sucked in. Okay, and when we see here, it appears like a retracted tympanic membrane. So how will be the retracted tympanic membrane appear like? I will draw a diagram to show you. Say 1 minute. So the retracted tympanic membrane will be like this. Okay, that means the tympanic membrane, which should be like this, okay, has been retracted like this, okay, because of negative pressure here. Okay, so now what are the important points here in a retracted tympanic membrane? Here the handle of malleus will be it appears like there will be foreshortening of the handle of malleus. The handle of malleus will appear like foreshortening of handle of malleus, okay, and the lateral process of malleus will appear more prominent. The lateral process of malleus will appear more prominent. Okay, and one more thing, the next thing, the cone of light, it seems to be distorted. The cone of light seems to be distorted. It is not perfect. The cone of light seems to be distorted. So these are the classical features seen in a retracted tympanic membrane. There will be foreshortening of the handle of malleus, right, and the lateral process of malleus will be more prominent, along with the cone of light seems to be distorted. Okay, so if a person comes to you in this stage, when you see the tympanic membrane, it will be like a retracted tympanic membrane. This is the first stage of tubal occlusion. Okay, the patient will just have a symptom of, there will be a mild earache, there will be a mild ear blocking sensation, that's it. If you treat the patient at this stage, he will become normal. Okay, or now if he doesn't get treated, or if he doesn't come to a doctor right now, okay, he comes at a later stage, now goes to the stage of second stage. What is the stage of second stage? Stage of pre-suppuration. So as the name indicates, it is pre-suppuration. Suppuration is a bacterial infection or a pus getting collected. Okay, so what happens? Because of the now, as I said, the tympanic membrane will be retracted because of the negative middle ear pressure. Okay, and what is the other function of eustachian tube? The other function of eustachian tube is to clear the middle ear secretions into the nasopharynx. Okay, now this clearance this clearance is not happening. Okay. So, now what happens? There will be collection of secretions. Okay, there will be collection of this fluid within the middle ear. Okay, once the fluid gets collected in the middle ear, there will be accumulation of pyogenic organism. There will be bacterial infection occurring. Okay, once the fluid gets collected for some hours or days, there will be bacterial infection occurring. Once there is a bacterial infection occurring, now this stage is called as stage of pre-suppuration. Okay. Now, how will be the patient symptoms or how will be the patient signs now? Okay. Now, the patient symptoms will be, how will be present is, now again the patient is having a ear blocking sensation, right. Along with that, there will be severe ear pain. Why? There is a bacterial infection setting in. So, there will be a severe ear pain. Along with that, the patient will have a fever, which is usually a high grade. The patients, because of the bacterial infection, he will start to have a high grade fever. Okay. And some adults will even have, because of the blockage, they may even have a tinnitus. Right. So, these are the stages of pre-suppuration, these are the symptoms present in the pre-suppuration. Okay. So, now how will be the signs? So, for seeing the signs, how will it appear? So, now when we see the tympanic membrane, now as a doctor we are examining the tympanic membrane. As I said, right now the tympanic membrane won't be retracted. Okay. Now, because of the accumulation of this fluid here, okay, the tympanic membrane will appear congested. Okay, the tympanic membrane will appear reddish and congested. Okay. Along with that, what will happen? There is a sign when we just see through the tympanic membrane, it appears like there is a streak of blood vessels starting from the handle of malleus towards the periphery. Okay, running from the handle of malleus towards the periphery, it appears like a spoke of alloy wheels. This sign is called as cartwheel sign. Cartwheel sign. Okay, it appears like a spoke of blood vessels starting from the handle of malleus towards the periphery. Okay. So, coming on to the next thing, there will be, as I said, the patient will have a high grade fever and the tympanic membrane will appear reddish and congested. Usually it starts from the pars tensa region, and at the final stage even the pars flaccida may also appear congested. Okay. This is regarding stage of pre-suppuration is concerned. So, now here you are giving some treatment, and if the patient gets settled, well and fine. Okay, you are going to give the antibiotic continuously for 3 days, and that is the treatment we will discuss later. We will give for 3 days, and if it improves, we will give it for a course of 10 days to finally conclude the full course of therapy. Okay. Now, the patient as in started treatment, he started asking doctor lot of questions. He started asking that, doctor, why I need to start antibiotic? What is the role here to start antibiotic? Let him die. So, going on to the third stage. Third stage is stage of suppuration. Stage of suppuration is, as the name indicates, now there is a full blown infection setting in. Okay, that means now the tympanic membrane, okay, now if this is the tympanic membrane, now here what I said, the bacterial infection, right. The bacterial infection is now turning into pus. Okay, it's now fully filled with the pus. Okay. So, now what will happen is, it will appear like the tympanic membrane along with congestion, okay, along with congestion and along with bulging, okay, it appears like the tympanic membrane is about to rupture. We can see that the tympanic membrane is fully reddish along with some white pus behind the white pus in the middle ear, which we could see through the tympanic membrane, white or yellow pus which we could see through the middle ear. Okay, the tympanic membrane will be filled with pus. Middle ear will be filled with pus, which we can see through the tympanic membrane. So, now either what will be the patient symptom now? The patient symptom again, here the fever will be very high grade. That means the child may have a temperature of around 102 to 103 degree, very high grade fever. Okay, and if it gets uncontrolled, the child may have even a very high grade of fever, may also turn into vomiting, even some febrile seizures may also occur. Okay. So, this is the stage of suppuration is concerned. Okay. So, what will be the sign? As I said, the tympanic membrane appears to be bulging and congested as the stage of pre-suppuration, but here in this antibiotic era we are not able to see some yellow pus and all, but what will happen is this yellow pus seems to push the tympanic membrane out. It will seems to push the tympanic membrane out, and it will appear like some nipple kind of thing projecting. We can see some weak spot in the tympanic membrane which appears bulging and it is about to rupture. Okay, we can see some nipple kind of projection which is pushing from inside because of the pressure effect. This is stage of suppuration. What is the treatment needed? Again we are giving a course of antibiotic at this stage. But now again the patient is questioning you and he has not taken antibiotic. Now what will happen is, either it will go into stage of resolution. If the patient is fine enough, okay, the patient immunity power is fine enough, he may turn into stage of resolution. So what happens is, at one stage, as I said, the tympanic membrane is here, the middle ear is full of pus here, right. So what in the previous stage what I said, it will appear like some nipple is projecting here, right. It will, some pus is about to project. Okay. So finally what will happen is, it will make a small hole in the tympanic membrane, right. It will make a small hole in the tympanic membrane and the pus will drain out through the tympanic membrane into the external atrial canal. Okay. Once the pus comes out, what will happen? The pus quantity in the middle ear get reduced. So the patient's ear pain, fever, symptoms goes low. It gets reduced. Okay. The child will become comfortable. The child will become normal, except that only one symptom the child will have, the parent will bring the child or the patient will come to you with, the patient will have some blood stained ear discharge or a mucopurulent ear discharge. Blood stained is because it is putting a hole in the tympanic membrane and coming out. Okay. Either a blood stain, and first there will be blood stain and it will turn into a mucopurulent ear discharge. So this will be the symptom now the patient will present to you. Okay. And when you examine the child or when you examine the patient, the sign is, here you could see some discharge in the external atrial canal, discharge along the external atrial canal. When you see, along with that you can see some small pinhole perforation in the tympanic membrane. Okay, pinhole perforation. Okay. So or if we have either, this is a stage of resolution if the patient doesn't start antibiotic in the previous stage. If the patient would have started antibiotic in the previous stage, the symptoms would have resolved by itself without putting a perforation. Without making a perforation, the symptoms would have resolved. Okay. And what it would have happened, the eustachian tube would have been functioned normally and the pus now would have gone through this eustachian tube and into the nasal cavity. The child symptoms would have got reduced. Okay. So if you would have started antibiotics in the stage of suppuration itself. Okay. Right now. So these are the 4 stages. Coming on to the stage 5, 5th stage, that is the stage of complication. So usually when it occurs, either if the virulence of the organism is very high, okay, the virulence is very high, or if the patient's immunity is very low, then the child or the adult may turn into complication. The complication we will discuss in another topic. As we know, the most common complication is either it will turn into mastitis, okay, or it can turn into petrositis, or it can turn into a facial nerve palsy, or it can turn into any inner ear inflammation, that is a labyrinthitis, okay, or it can turn into any intracranial complications. Okay. So these are the 5 stages of ASOM which no one should forget before writing a ENT exam. Okay. In a ENT exam, this is a short note for you. In a ENT practical, this is a must question for you. And in a competitive exam, they may ask in which stage cartwheel sign is seen, and in which stage, how say a 20-year-old boy or a 5-year-old boy coming to your OPD with signs of ear pain. The patient is having ear pain and signs of fever, and on examination he has a cartwheel sign positive. So what could be the stage? The cartwheel sign positive indicates the stage of pre-suppuration. right. Again now a patient, a 20-year-old male comes to your OPD with complaints of ear discharge. Okay, on examination the tympanic membrane appears congested, but there is some ear discharge in the external aortic canal, and when you see, you could see some pinhole perforation in the tympanic membrane. This indicates a stage of fourth stage of resolution, right. So this chapter is very important for you, and I hope it will be helpful for you, right. If you have any doubts, you can, as I previously said in my previous videos, you can either WhatsApp me in my number, or you can join my Telegram page for instant discussions, in which my name will appear like Dr. Rajesh exploring ENT. Okay, or you can join my Facebook page also in the same name. Okay, thank you.